Hi, my name is Dr. Erin Walborn and I'm the audiologist here at Audiologic Solutions. You might be asking, well, how do I know if I need a hearing test? So I want to answer that with just a few common symptoms that happen, and then with some of the medical and social and psychological consequences of not treating hearing loss. So the first thing you might want to ask yourself is, am I asking others to repeat? Do I think other people are mumbling? Do I sometimes avoid or drop out of situations? When I get into a noisy room, do I struggle or do I feel like I have to really, be stressed and really looking at the person to hear? Do I hear but not always understand? Is it hard to explain your hearing loss to somebody? Like, I can hear a pin drop, but I didn't hear my wife talking or my husband talking. Those are some of the things that are signs of hearing loss, and they're subtle. It's not like losing your eyesight. When you lose your eyesight, you're the first person to realize it. Things are blurry. Well, when you lose your hearing, you're the last person to realize it. You don't know that you've missed out on something or that you misinterpreted. So we really have to rely on some of our loved ones to be telling us that we're having problems. Now, on average, it takes people 7 years from the time they start to realize they have a problem to the time they actually do anything about it. And that's a little concerning to me as an audiologist, because studies now show that hearing loss that's left untreated has been linked to a number of problems. And I want to read you those problems. So, untreated hearing loss has been linked to irritability, negativism and anger, fatigue, tension, stress, and depression, avoidance or withdrawal from social situations, social rejection and loneliness, reduced alertness and increased risk to personal safety, impaired memory and ability to learn new tasks. Interesting. Reduced job performance and earning power, and diminished psychological and overall health. So I encourage you that if you recognize any one of those symptoms that I mentioned earlier, or if other people are telling you that you're just not hearing as well as you used to, don't put off getting the hearing test. We encourage you to call us, make an appointment. You'll be seeing myself or one of my colleagues, and we'll be taking you through the entire process. So I hope to see you soon.